On today's episode of the podcast, I got to sit down with one of my all-time girl crushes, idols when it comes to the women's health space, Sarah E. Hill. She has a PhD. She is a research psychologist and she specializes in women's health, understanding what our hormones are doing and why we feel how we feel. You may know her from her famous work in How the Pill Changes Everything. And now she has a new book out called The Period Brain: The Science Behind Why We PMS and What to Do About It. In today's episode, we spoke about the natural changes that happen across our menstrual cycle and the things that we can start to understand are actually normal and when to know when things are going a little bit skew-if. We talk about the wisdom that comes with each of the different parts of our menstrual cycle and how to care for ourselves when we are experiencing things like PMS, PMDD, and endometriosis. She is an absolute wealth of knowledge. I was shaking at the start of this episode because she's just one of those incredible people that I was so lucky to sit down with. And I'm so excited for you to dive into this episode. So let's get into it. Let's start listening to our body differently. If you've ever felt dismissed, confused, or stuck in the space between symptoms and answers, you're not alone. This is What's My Body Telling Me? With me, Dr. Anthea Todd, the podcast where we believe your body isn't the problem, it's the solution. Together, we'll explore how to understand the messages your body sends through symptoms, how to support yourself through every stage of life, and why functional health, medicine, and energetics are all key to understanding and supporting your body. Here, we let feeling good become the baseline because life's too short to feel anything but alive. So, are you ready to start listening differently? Let's get into today's episode. Sarah, thank you so much for joining us on the What's My Body Telling Me podcast. You've just recently released a book, Period Brain: The Science of Why We PMS and How to Fix It. I've been listening to it on audiobook, and you also thankfully forwarded me the PDF copy because I'm in Australia and we don't yet have it yet. In there, you say that 75 to 90% of women that are reproductive age experience PMS. So is PMS normal or is it just common?
That's a really good question. And the answer is a little bit of yes. And so like when you look at what like PMS is, it's really a hodgepodge of both things that are happening on purpose in the body as the body is transitioning from, a state that's optimized for attraction and sex, which is the first half of the menstrual cycle and is, of course, coordinated by estrogen, and then shifting into a state that's optimized for implantation and pregnancy. So some of the symptoms of PMS are things that women are experiencing as a result of their body making this change. But some of it is completely unnecessary, right? And it's the result of the fact that we've completely ignored the fact that our bodies are cyclical and we're giving women one size fits all sets of rules for how they're supposed to be taking care of themselves and what their bodies need. And so when we ignore our cyclicity and ignore the fact that our bodies needs change, that can actually create pathology, right? It can actually make our body do things that where it's misbehaving and leading us to feel less good than how we should be feeling. And then lastly, there's just this issue of our environment has changed so much in the last, 250 years as a species that it's eroded at what I like to call our resilience to hormonal changes, which is just really our cellular flexibility and the degree to which our cells are able to quickly adapt to changing hormone levels. And because women experience such huge hormone changes in the second half of the menstrual cycle, because the hormonal changes are so much greater than what happens in the first half of the cycle, if you don't have cells that are really able to quickly adapt and adjust what they're doing in response to rising and falling levels of both progesterone and estrogen, then this can also create friction in the body and psychological friction that doesn't feel very good.
Because it's almost like, well, every woman cycles, like having, as you
Yes.
alluded to, and I was listening to one of the other podcasts you've been doing on this very long podcast circuit that you've been on. I'm so grateful that you're on the podcast. But in the first half, you mentioned, yes, it's follicular. That's where estrogen is the most dominant. And in the second half, that's the luteal phase where progesterone is the most dominant. And you mentioned that the first half is all about reproduction. Like we want
Hmm.
to go out, find a mate. We do a little bit more risky behaviors, possibly. But then in the second half, it's really about, well, you could potentially be pregnant. So we want to shift gears and
Hmm.
manage that. So could you talk a little bit more about that and the changes that we might experience naturally?
Yeah. So, it's really interesting because the fact that women have two sex hormones in the first place is a testament to the fact that our brain and our body has to do two different sets of activities in order to reproduce. Men only produce one primary sex hormone, testosterone, because their bodies only need to do one thing to reproduce, and that's have sex. And for a female body, you have to have sex, right? And then you also have to get pregnant. Right. And that's the reason that our hormone cycle is that in the first half of the cycle, when estrogen is rising, it orients our brain and our body to a state that's optimized for attracting a mate and then having sex. And then in the second half of the cycle, it's orienting our brain and our body to a state that is optimized for implantation and pregnancy. And the result is we get changes in our body from head to toe that extend far beyond just the inside of the endometrial lining, right? Which is where
Mhm.
all the attention has been for so long. But psychologically, this changes women. And so, for example, as you had noted, in the first half of the menstrual cycle, when sex can lead to conception, this is a time when women tend to feel really sexy. They tend to have higher levels of sexual desire. So they want more sex. They tend to have more sex. They're better able to distinguish fine tuned differences between men. So, for example, women become more sensitive to cues related to scent, and they're better able to detect even small differences in testosterone metabolites in male scents at this time. So our brain is just like ready to go. I mean, it's like primed for sex. It increases our ability to distinguish between higher and lower quality mates. And it really is a time when women tend to have more energy. They tend to be more outgoing. So women report having a greater number of social interactions in the first half of the menstrual cycle, and that they just really feel sort of outward facing during this time when their body is optimized for sex. And it's not just that the women feel good and want to have sex themselves, they also look good, they smell good, they sound good. And there's all of this really great research that finds that men prefer women at high fertility in the cycle compared to low fertility in the cycle when it comes to the way that they smell. So they've done these stinky t-shirt studies, where they have women wearing a t-shirt overnight without any scented soap and without deodorant, and they wear it either in the high fertility phase of the cycle, so near ovulation when estrogen is high, or in the low fertility phase in the cycle, in the luteal phase when progesterone is high and sex can no longer lead to conception. And what
Mhm.
that research finds is that men like the scent of women at high fertility compared to low fertility. They like the way that women look. So they've done studies where they take pictures of women at different points in the menstrual cycle and just have people evaluating their facial attractiveness. People like the way that the women look more. Exotic dancers earn more money near high fertility in the cycle compared to in the luteal phase of the cycle. The way
Wow.
that women move is found sexier. Men prefer the sound of women's voices. I mean, the studies just go on and on and on. And so it's essentially, during the first half of the menstrual cycle, when estrogen is rising and sex can lead to conception. I mean, this really is a time that gets our whole body and our whole brain oriented toward attracting mates and having sex, and that feels really good to a lot of women. Most women really enjoy the first half of their menstrual cycle because they do experience, especially during the second week, this rise in estrogen that's related to all of these positive physical and psychological changes. Right. And then when you move into the second half of the menstrual cycle, sex can no longer lead to conception. And so what that means is that the body is going to be directing all of that energy that it was investing in doing things like attracting mates and having sex. And it's going to be redirecting that energy toward other activities, particularly activities that would help to support implantation and pregnancy.
Mm. I find that so interesting because when I was listening to your audiobook, I was talking to a lady that works with me, Shelby, and she was mentioning because she sometimes experiences more PMS
Mhm,
from month to month. It actually varies month to month.
mhm.
Um, and I was saying to her, because I was listening to the part where you mentioned that when our progesterone is higher, the fear and threat detection part of our brain alters. And that
Yes.
morning, I happened to go for a walk with a friend and someone was running behind us. It was broad daylight. We're right next to the beach, beautiful, calm. Someone was running behind us, and my first instinct was, what happens if they have a knife or they try and grab us from behind? Like there was heaps of people around. Like it wasn't the
Yeah,
environment. I'm like, why was that my immediate thought? And then today, where I'm ovulating, I'm on the beach, and it's just like people come behind you, but it's all fine.
yeah,
Like that threat detection part of my brain isn't as alert. So
right.
knowing that information, I'm like, oh wow.
Yeah, so one of the changes that our body and our brain undergo as we shift into this phase of the cycle, the second half or the luteal phase, when progesterone is high and rising, is that because our body is preparing for the possibility of pregnancy, and pregnancy may even already being, having taken hold as far as our brain is concerned. One of the things that progesterone does is it actually increases the sensitivity of the threat detectors in our brain. Right. And it does this because pregnancy is a time of intense vulnerability for women, right? They're less able to get away, right? And they also,
Mhm.
it's a time when they're going to be very reliant on their male partner for protection and provisioning throughout most of our history. And because of this, what we tend to see is that the threat centers in our brain become more functionally interconnected with a greater number of brain regions, which essentially increases our attunement to threat. And this means that things that might not normally bother us are going to be more likely to make us nervous or feel concerned in the second half of the cycle compared to the first. And so, when you talk about somebody running up behind you, do you know what was happening hormonally when that happened?
I was in the luteal phase, yeah.
Yeah,
And that's
no,
what I find so
exactly.
fascinating. It's like, oh
Yeah,
wow.
it is so fascinating, and then so it's like the exact same stimulus can cause a really intense fear response in one half of the cycle and not in the other. And research finds that this is true with both physical threats like you were talking about there, but also even potential threats to the relationship. So for example, research finds that relationship insecurity also increases in the second half of the menstrual cycle in response to progesterone. And so this is the effect that happens and a lot of women I know and many of you listening, you may have had this experience where your romantic partner could, just tell you like, "Oh yeah, I've got to stay late for work." And you're like, "Okay, no big deal. All right, see you when you get home." Right? But then 2 weeks later, right, when you're in the second half of the menstrual cycle, they do the same thing and you're like, "Wait a minute. Wait, like, what are you working on? Like, who are you working with? Like, is there a
Oh,
problem?" Right? And so the exact same stimulus can create very different responses because our alarm bells in our brain have been designed to be more sensitive during the second half of the cycle because of our intense reliance on our partners for pregnancy throughout most of human evolutionary history, right? Because even though we are now contemporary women where we no longer need to be reliant on men and we might not even have male partners, right? Our brain is still wired from this evolutionary process in which women were very much, needing to lean heavily on men to be able to protect them and provide resources for them during times of childbirth and soon after, or pregnancy and soon after childbirth.
yeah, that's so interesting. And that's when I was reading this in your book, knowing that progesterone is higher in that second half of the cycle, but also the research that you mentioned where progesterone therapy is used for people with PTSD and it's a natural
Hmm.
anti-anxiety. It stimulates that the GABA receptors, so the calming parts of the brain.
Hmm.
There's something in my I can't understand how,
Right,
like, if it's meant to be anti-anxiety and it's
right.
calming, why do we feel more alert and on edge in that second half and the highest?
Right, right. So there's a couple of different things going on here. So to start with, like fear and
Mhm.
anxiety are not the same thing. All
Mhm.
right. And so even though the fear centers in our brain do get primed and they are more functionally like or the fear center in our brain is more functionally interconnected with a greater number of brain regions in the second half of the cycle compared to the first. This doesn't cause a generalized anxiety effect. Instead, it just makes us more vigilant to signs of threat. All right, anxiety is a little bit of a different beast. Anxiety is the result of the brain feeling overwhelmed and not having resolution for that overwhelm. So anxiety doesn't generally have a source, right? Like so you can
Mm.
feel anxious about something, but like actual like generalized anxiety is not generally related to a specific threat or the perception of a threat. It's just a generalized feeling like our brain is being overly excited, but not in a positive way, right? Being overly excited in a negative way. And the thing that progesterone does that is actually anti anxiety is that it actually stimulates GABA receptors in the brain. And it does this through a neurosteroid called allopregnanolone that gets released when progesterone is broken down in the body. It releases this as a compound, as a metabolic byproduct of progesterone, and it has a really strong affinity for GABA receptors in women's brains, and this has the effect of actually calming the brain down by slowing excitatory neurotransmission, just meaning that the brain
Mm.
is slowed down, and it can inhibit overexcitation in the brain, which can lead to generalized anxiety. Now, in terms of like the feelings of actual generalized anxiety, the heightened sense of generalized anxiety that women can sometimes get in the second half of the cycle.
Yeah.
Oftentimes we tend to see that in the late luteal phase, which is the last week before you get your period. And this is like one of those things where it gets kind a little bit in the weeds with like what's actually happening mechanistically. But essentially, as progesterone is being released in the body, it releases this neurosteroid allopregnanolone, calms the brain down, right? Which is why
Mhm.
they give it to people who have PTSD, and people who have had traumatic brain injuries, because it slows down neurotransmission and has this like calming effect in the brain. And now, you're releasing progesterone, progesterone's increasing, increasing, increasing. Your brain is calming and calming and calming and very kumbaya. And then all of a sudden, progesterone levels start to fall.
Mm.
And for some women, their brains are not able to quickly adapt to the fact that they're having less of this GABAergic activity, is what we call it, from being not as much stimulated by allopregnanolone when progesterone levels are falling. And the result of this is essentially that you have a bunch of naked GABA receptors that are expecting allopregnanolone, right? And just like depending on it to calm itself down. And then it's not arriving because progesterone levels are now falling. And
Mm.
that can create generalized anxiety that women get sometimes in the second half of the luteal phase. So here's like if we're breaking the menstrual cycle up into four chunks instead of two,
Mm.
this would be the fourth chunk. This would be your late luteal phase. And when progesterone levels are falling, one of the things that we do see in the research literature is that this is a time when women are more vulnerable to the experiences of like just generalized anxiety, where they just feel anxious, but it's not about something. It's
Mhm.
just feeling anxious. And
Mhm.
this is believed to be a byproduct of the fact that you're getting withdrawal of progesterone and withdrawal of allopregnanolone. And this is something that tends to really get triggered by, as I noted, one of the things that produces like what we call like these PMS symptoms is women lacking resilience to hormonal changes. So if you have like high levels of inflammation, for example, all of this stuff decreases your cellular plasticity, and it makes the cells in your body less able to quickly adapt to quickly rising and falling levels of progesterone. and
Mm.
um and that can feel really terrible because and there's a lot of variability in this, because some women have a lot of cellular plasticity, and so if their brain is like releasing a ton of progesterone and then all of a sudden less progesterone, their cells are able to withhold progesterone receptors and then sprout new progesterone receptors, so that way mechanistically the amount of transmission, like hormone transmission in the cell, is being kept relatively constant despite the
Mhm.
fact that levels are rising and falling rapidly in the body, right? Because the cells are able to sprout new spines to pick up more, or retract receptors, so that way it's picking up less. And
Mm.
women who don't have a lot of cellular plasticity because of things like inflammatory activity in the body is one of the big eroders of this. Their cells can quickly feel really overwhelmed or underwhelmed by the amount of hormonal activity that they're getting, because they're not able to sprout and retract receptors as quickly right? Then leading to sort of bigger deviations from homeostasis, which is what the body likes.
Yeah, so it's almost like, well, our PMS, and this is what we talk about here is our body isn't the problem, it's the solution. So our
Yeah.
symptoms that we're getting are trying to tell us something underneath the surface. So it's almost like what you're saying there is if you are noticing more PMS like symptoms around that this week before your period, particularly
Hmm.
when we want that cellular adaptability, that is a sign that, oh, you don't necessarily have that flexibility. So why
Hmm.
is that? And we need to address that.
Yes.
Even
Yeah,
in-
excellent. Yes, exactly. And I mean, ultimately a lot of that comes down to like really it's a lot of lifestyle changes that can help promote your cellular plasticity. And one of the biggest factors that contributes to the erosion of our cellular plasticity is inflammatory activity and runaway inflammatory activity, runaway stress. Right?
Mhm.
These 2, contributors are big ones that can really, lead women to feel a lot worse than what they actually need to feel. And
Mm,
so in the period brain, I spend some time talking about, like, practical, lifestyle interventions that women can make, and even just starting small start to help increase their resilience to these hormonal changes because a lot of the women that I know, and a lot of women I've spoken to over the years, they really do experience much worse luteal phase, like they experience much worse PMS than what's actually necessary, because there
mm,
is, some of the things that we experience are just, the body changing and in ways that are functional, that we haven't been given a language to understand. Like we talked about the fact that,
mm,
given that you become more vigilant to threats during this time, most women aren't told about that, right? And instead, it just feels like you're being moody, right? Or overly emotional, but instead, it's our body's actually doing something on purpose, right? You get a decrease in sexual desire. And again, that it makes total sense. And the body is doing that on purpose because sex can no longer lead to conception during the second half of the menstrual cycle. And so the body is just like not investing as heavily in mate attraction and sexual desire and sexual function in the second half compared to the first, just because evolutionarily it's kind of a little bit of a dead end. It's like it's not a wise use of bodily resources, and when you could be using those resources to do things to help promote successful implantation and a pregnancy. And so the body shifts gears, and so some of what we think of as like PMS is really these functional changes that are happening that women just haven't been able to understand. But then some of it is also just, we feel a whole lot worse than what's really necessary because we no longer prioritize sleep and we no longer prioritize movement. And many of the like foods, the things in the grocery store that masquerade as food are not healthful and
mm.
don't promote the health of the body and instead are pro inflammatory and are not nourishing and don't nourish the gut, which is really important also in terms of helping to have our body have inflammation low and have a lot of cellular flexibility, which
Mm.
then allows us to be able to quickly adapt to changes across the cycle in ways that don't feel miserable.
Yeah, I think I I love that, and I think it's understanding that each part of our cycle serves an amazing purpose when we
Hmm.
understand the wisdom that comes with each part and not necessarily making it a diagnosis or now with
Yeah.
psychology in in that part of our cycle. I know I sort of explain to patients, and I'd be curious your thoughts on this. I sort of explain it like you're in the ocean and there's waves and there's sets of waves. So sometimes there's a
Uh-huh.
lull, like there's no waves, like when we have our period, our hormones are at their lowest point. And then all of a sudden the wave starts to build. We get the estrogen and then it crashes down. Then we get the build and progesterone, then it comes back and then we get a lull. And when we
Yeah.
first start to get our period, when we hit puberty and we're in that sort of like first couple of years, it can feel overwhelming because
Yeah.
it's like, oh my gosh, now we're in waves and we have to be able to navigate them. And then when we can, it's like, oh my gosh, I can surf these waves and this is really fun and this is great. But when the seabed floor moves underneath the ocean, the waves get really big, like there's tsunamis. So that's
Mm-hmm.
what I mentioned to the people that I work with is that when the seabed floor is shaky, the waves
Uh-huh.
like you can't handle it. Like, you've got the different symptoms. But when the seabed floor or those fundamental things that we need for cellular flexibility are taken care of, the waves, yeah, oh, it's a bit, oh, I'm sitting and there's a lull, there's no waves. And now all of a sudden I can catch a wave and then I go back down. So there's natural ebbs and flows, but we don't feel like we're necessarily drowning in our symptoms.
I love that. I love that explanation because yeah, that's exactly it's very similar. I always like talk about it like coasting up and down a hill or
Mm.
careening off the side of a cliff. And as our hormones shift and we sort of transition, which really is a big job for the body to do, to be
Mm.
transitioning from the state that's just like all about like being sexy and out there and attracting mates and sex, 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 and then shifting into this sort of matronly, I need to withhold energy because I'm building this really incredibly expensive endometrial layer and my respiration rate is up and my heart rate is up and, my body's working really hard and I just don't have a lot of resources. That's a big job for a body to do. And that our bodies are
Mhm.
able to do this every month is really remarkable, and that we're still able to feel like a whole, human
Mm.
who has integrity. It's like we have integrity within our system and we understand ourselves as a whole human, despite the fact that we're going through these huge changes. And when they're happening the way that they should, when our body is optimized, like you were saying, when we have a solid seafloor. Right.
Mm.
It just feels like coasting up and down a hill. But then
Mm.
when the seafloor drops, yeah, it can start to feel like a tsunami or feel like you're careening off the side of a cliff because your
Mm.
body isn't able to make those adjustments because our bodies really do. I mean, it's such an undertaking, to have to transition and transform our body and our brain in the ways that the female body is able to do every single month. It's really incredible. And one thing that I hope that readers of the book take away from them, take away for themselves is just what a remarkable system it is that we have inherited. I mean, it's just this brilliant, really beautiful, elegant system. And the
Mm.
fact that our bodies are able to go through these shifts and these changes and for people who are taking steps to maintain the integrity of their seafloor, that it really you're able to do it with minimal, bumps in the road. It's just like enjoying the full spectrum of being female.
Yeah, and I think to your point, what you first mentioned about the societal understanding and possibly the pressure of, well, you have to perform the same at every day in your cycle. It's almost
Mhm.
like, well, maybe the cure for PMS, or what PMS is telling us, is that one, we need to take care of that seabed floor, the fundamental things
Mhm.
our cells need to be able to change, and then also understand that we're not meant to be the same at every part
Yes.
of our cycle, and there's wisdom in each part. Like, we can actually really lean into it and go, oh wow, how incredible! In the first half, I've got more energy and I'm more outgoing, and I can do more things that are more aligned with that. But then in the second half, it's like, oh, maybe I get a bit more wisdom. The threat detection part of my brain is up, and that can help me check and measure and go, I know I was really gung ho in the first half of my cycle, but do I actually really want to do that? Or is that actually in alignment with me? And I think that sounds like a much better way to live than trying to be the same the whole time in your cycle.
Yeah, and I think because most of the recommendations that people are given about what they're supposed to be doing and how they're supposed to be taking care of their bodies has been, based on research conducted on men,
Mm.
that we really haven't given enough appreciation to the fact that women's needs change and that we're not exactly the same from
Mm.
one day of the cycle to the next, and certainly from the first half of the cycle to the second. And I think that another reason that women experience the second half of the menstrual cycle as being pathological is because a lot of the wisdom that we've been given about what we're supposed to be doing is really geared toward us during the first half. And just
Mm.
to give examples of this, we know that women's resting basal metabolic rate increases by 7 to 11% in the second half of the menstrual cycle in response to progesterone, because our body is working harder to build this endometrial layer and differentiate all these cells and breast tissue and beyond. And this is something that requires a lot of effort. And our resting heart rate increases, our breathing increases, our body temperature increases. All of this takes a lot of energy. And the result is that our resting basal metabolic rate increases. And like I said, for it's about 7 to 11%. And so if you're somebody who eats 2,000 calories a day, this is like an additional 200 calories a day that your body is burning in the second half of the cycle compared to the first. And if you're given one size fits all nutritional guidelines that say, hey, Dr. Athena, you should have, this many calories a day, and you're in the second half of the cycle and you're really hungry, then you're going to be cranky. And if you're
Oh,
not eating, you're going to have food cravings, right? And you may end up having a binge eating episode, which we know women are much more likely to have a binge eating episode in the second half of the cycle compared to the first. And it's because they're given bad advice. And
mm,
they're like, the assumption is, oh, we can just tell women what they should be doing, and it's going to be the same day every day, because for men, hormonally, it is the same day every day, but for women, it's not. And so when you give women a set of guidelines about like what they should expect in their bodies or what their bodies need, that isn't specified to the fact that, as your hormones change, then your body's going to change and your body's needs are going to change. It really can lead to you feeling, pathological, like there's something wrong with you. And I think it's really played an important role in, like, so many women I know just have a terrible relationship with their bodies, and they feel like their body is the enemy, and
mm,
they feel, they have all this negative self-talk with themselves about, you know, oh, I just can't do this. Like, I just don't have good self-control. And so much of that is, I think, completely unnecessary and is the result of the fact that we've been given a bad set of instructions that were
mm.
never made for our bodies. And then when our bodies rebel, we're blaming ourselves. It's
Yeah.
like, no, it's like nobody has questioned.
You know your body better than anyone. So why do your test results say everything's normal when you don't feel normal? Fatigue, bloating, period pain, mood swings, anxiety, these aren't random. Your body isn't broken, and these symptoms aren't just something you have to live with. They're signals that something deeper is going on. That's where Test Your Fundamentals comes in. Using a hair tissue mineral analysis, or HTMA, this test gives you a 3-month report card of how your body's been functioning, internally and externally. It shows you exactly what's happening beneath the surface, so you can stop guessing and start listening to your body in a different way. Unlike standard blood tests, HDMA reveals nutrient imbalances, heavy metal exposure, and deficiencies that could be impacting your energy, hormones, metabolism, and mental clarity. It doesn't just tell you what's happening, it tells you why. With Test Your Fundamentals, you'll get a personalized HDMA test, an easy to understand breakdown of your results, access to practitioner quality supplements tailored to your body's needs, and lifestyle recommendations to support all 4 of your fundamentals, so you can take action that actually makes a difference. If you've been told that everything looks fine, but you know something isn't right, it's time to dig deeper. Visit femalefundamentals.com.au to order your Test Your Fundamentals hair test today. There's also a link in the show notes. It's not what's wrong with me, it's what's my body trying to tell me.
So, I mean, it's women will like question themselves before they question the rules. And most of the
Yeah.
rules that women have been given aren't made for someone with a cycle. And the fact is, our calorie needs do increase, and so do our sleep needs and our recovery needs. And we know that women are are more introverted and less extroverted in the second half of the cycle as part of this sort of energy conservation effort that the body is undergoing to make sure it has enough resources for preparing for pregnancy and then possibly pregnancy. And when we ignore those things and we don't give women any understanding of what their bodies are actually doing and what they need, it really does. It creates pathology, and it can really destroy women's relationships with themselves.
Yeah, there was a quote. I was listening to your book on a drive this weekend, and I had to pull over and write this in my phone because you said, rather than questioning the advice we've been given, we instead learn to distrust our body's signals.
Yes.
Like, that is just
Yes. Yes.
because of what you mentioned in the research and how it's been set up. We research male bodies.
We
So
research male bodies.
and the second half of our cycle is pathological because we don't really want to deal with what happens with the progesterone. So it's like,
Exactly. Yeah, and so it's like most of the guidelines that we've been given and most of our understanding about what the body is supposed to do, whether in sickness or in health, is based on research that was conducted in men. And then once they started including women in research studies, then, they were generally studied only in the first half of the menstrual cycle, particularly soon after menstruation is done. So when hormone levels are relatively low and when women are maximally similar to men. And
Yeah.
they would only study women during this time to try to minimize the impact that women's sex hormones would have on any of the outcomes that they're measuring, without
Mm.
ever considering the fact that we need to know that because women are hormonal. So most of the research that actually finally includes women, a lot of it's done in on women in the follicular phase. It's not ever done in the luteal phase. And so the result is that most of the recommendations and most of the guidance that we've been given isn't made for someone with a cycle. And it's certainly not made for somebody who's releasing progesterone. And this means that during the second half of the cycle, there's going to be things that happen within our bodies and even with our potentially with our reactions to medications that we take that are never accounted for in the research because they're never studied. And so this is one of the reasons that I think it's so important for women to really educate themselves about the important changes that they experience across the cycle, right? And so I wrote The Period Brain to really give women a blueprint of what it is that their body needs and what their body is experiencing as it's transitioning into the second half of the cycle. But then also, taking the time to get to know your own relationship with your cycle and tracking things, and especially, seeing how things shift in the second half of the menstrual cycle to get a better idea of how your body is responding to sleep, how your body is responding to if you've got a chronic health condition, because we know that women's experiences of chronic health conditions oftentimes change across the cycle with our hormones, whether or not your reactions to medication that you're taking or whether the medication that you're taking is effectively controlling your symptoms, that can change across the cycle.
Mm.
Whether your hunger, your energy levels, your sexual desire, your feelings of connectedness with your partner, all of these things can shift with our hormonal changes. And it's really, so empowering for women to get a handle on how their own bodies are responding to these hormonal changes, and so that way they have a better understanding of themselves. And then also I think it allows for better communication within relationships, because this is like another piece that I spend a lot of time talking about in the book, is just that, given that our brain becomes more vigilant and the nature of our sexual desire changes and we experience changes in energy levels and so forth as we transition across the cycle, once we actually understand these things, we're also able to communicate them with our partners
Mm.
and, people who love us. So that way we're able to get what we need out of our relationships when we need it. And this is another thing that I think that, because women aren't taught about any of this, a lot of times because we don't have a language to even explain what's happening to ourselves, it makes us completely at a loss with our partners. And this,
Mm.
of course, really, can create friction where friction is not necessary. And just to give, one example from my own life, I had this big blow up of a fight with my husband that happened, and it happened in the luteal phase of the cycle. But of course, I wasn't thinking about that at the moment, right? He had made some scheduling, he had made some scheduling issues, and I felt like, he didn't schedule time in for me, but he scheduled in time for other things, and so it was making me feel like there was something wrong with the relationship, right? I'm like, he doesn't value time with me, and I blew up. And I stormed out of the house. And then later I was driving in my car and I'm like, I'm in the luteal phase of the cycle. And ultimately, like, what he did, and he explained that it was a mistake, it was just essentially a mistake. And I'm like, what is my luteal phase brain doing right now? And it's like, okay, my threat detectors are primed and I am seeing this mistake as a sign that there's something in my relationship that's making me feel either insecure, right? Or like threatened in some way, like because generally the luteal phase brain is looking for safety and security, right? And so I ask myself, am I feeling unsafe? Am I feeling insecure? And then I'm like, okay, I'm not feeling safe in my relationship because of this small slip up. And ultimately that is what it comes down to. And so I called him and said, hey, I'm sorry I blew up, but ultimately I think that what happened was not making me feel safe in the relationship because I was feeling like maybe I value the relationship more than you do because you
Mhm.
didn't think about the time. And then he was able to give me what I needed, which was safety,
Mm.
and remind me of how important I am in the relationship, and remind me and just tell me, say, straight away that I'm safe in the relationship. And being able to ask for what you need is so powerful because, like, a lot of times, couples will get into fights about, like, not emptying the dishwasher, or forgetting to make time in a calendar for somebody. But that's not really what the fight is ever about. Right? It's about generally that you feel a lack of safety or lack of security. And as dumb as it might sound to feel lack of security from somebody not emptying the dishwasher, ultimately it goes like this: I asked you to do that. It's important. You didn't do it. You don't value me. I'm not safe.
Yeah.
Right. And ultimately, our brain is like running that little algorithm. And ultimately, it usually gets down to issues of safety and security. And so, when you understand this and understand that the luteal phase brain is primed for threats to safety and security, and then you can ask yourselves the question: do I feel safe? Do I feel secure? And then figure out ultimately what this thing that happened is tapping into. Then it allows you to go into your relationship with your partner and say, I need to know that I'm safe because here's why this was like upset me so much. And then
Mm.
that is a much more productive conversation than make sure you empty the dishwasher next time.
Yeah.
Right. Because it's not about the dishwasher.
No, and I think that's such a again, leaning into the wisdom that comes with the different phases of our cycle, is
Uh-huh.
it is that checking and measuring of, am I safe? Am I secure? Because sometimes you might ask yourself that, and it might not be a blow up over a scheduling or the dishwasher. It might be
Yeah.
something more significant that
Hmm.
the veil of estrogen has sort of gone away and progesterone's come up and
Yes.
going, actually, do you feel safe and secure in this situation? And then
Right.
also giving yourself permission to go, well, not even permission, just giving yourself the ability to then voice what's happening and see how your partner responds. Because in some instances, you actually might
Right.
not be safe or secure.
Right.
And that's the wisdom of the cycle.
No, absolutely, absolutely, because yes, the other side of that coin is exactly that, is that this is also a good opportunity then, if you don't feel safe and you don't feel secure, that this is a good opportunity to make note of that and
Mm.
then make the decision about how you want to proceed in your relationship. And I
Mm.
so many women have the experience of feeling like in the second half of the menstrual cycle that it's like the veil has been lifted, like the fog of innocence that gets clouded by sexual desire in the first half of the menstrual cycle. In the second half, it kind of gets removed a little bit, and you can see things. And in some ways, we're seeing things in a way that's less, rosy, and
Mm.
it's not always right. So this is also important to note: is that our threat detector is primed for vigilance, but that doesn't mean that it's more likely to be correct. It just means that it's less likely to miss a threat. And so
Mm.
also knowing that it's like, it's not that our brain is better at, being right. It's that our brain it errs on the side of assuming something terrible instead of
Mhm.
erring on the side of assuming something not terrible. And that it's just doing this as added vigilance to keep ourselves safe. And so kind of keeping that in mind, I think, is helpful. But then, as you noted, there's also some wisdom. And if you're reliably getting that sign that's telling you, I'm not safe, I'm not secure, then that also probably tells you something important about your relationship and something that you should probably take into consideration.
Yeah. So when we experience, so from one woman's perspective, say for instance, let's take me. I'm naturally cycling, not on any hormonal birth control, 28-day cycle. Why would it be that 1 month I could have more PMS than the other month?
Hmm. Yeah, no, and I think that this is all about your ocean floor, right?
Mhm.
And the fact of the matter is, what you tend to find, and I know that this is true for me because I have definitely have variable levels of negative experiences across the cycle. And for me, it is like when I'm having bad PMS, it is generally because I am not taking very good care of myself. And I
Mhm.
find that I have the worst PMS when I have a lot of stress going on in my life.
Mhm.
And also, well, it's usually stress, but, and it's also closely tied with that is lack of sleep. And so when
Mhm.
I'm not getting enough sleep and when I am under a lot of stress, I find that I definitely get worsening of the experiences that I have in the second half of the menstrual cycle. This can also be true if I'm traveling. I don't tend to exercise as frequently as I should when I'm traveling. I'm really good about it when I'm home, but when I'm on the road, I'm not.
Mhm.
And that's also something that can make my experiences worse. So it's like anything that really increases, inflammatory activity in the body, even like when it's transient, like across a single cycle, can lead to worsening PMS. But the good news for women is that really what this, on the one side, it kind of sucks because it's like you can live, really well most of the time, and then you have, a couple of really bad stressful weeks, and then you have a terrible cycle and it feels terrible. But
Mm.
the good news is that for women who feel like they have bad PMS and they know that there's lifestyle changes that they should be making to try to stabilize the ocean floor, is you can start to get some good results pretty quickly. And so
Mm.
even within the first couple of months when you're making these positive lifestyle changes, and even just like starting small with doing things to help set your circadian rhythms where you're getting enough sleep, will really make a difference, and you'll feel that one right away. I mean, I think that for the sleep changes, people start to get improvements in how they're feeling within that month. And so
Mm.
these are things that you can start to get benefit from as soon as you start doing them. It's not one of those things where, you have to do it for 6 months and then maybe you'll feel better. Instead, as soon as you start to make some of these changes and your body is able to start to improve cellular plasticity, that you get a more pleasant experience as you navigate hormonal changes.
Yeah, which is again a testament to how incredible the body is and how it's always giving us that feedback through our symptoms. Time for a body break. Are you feeling tense? Mind's racing, completely over how you're feeling and trying to find answers? Or maybe you're feeling magical. Let's do a fundamentals check in. Have you made time for play and fun today? Have you hydrated? And have you moved your body outside in the sun? Lastly, have you gotten enough protein and fat in your food? If you haven't, start here and see how your body responds. Remember, our symptoms are messages from our body that it doesn't have what it needs. When it doesn't have what it needs, we can start with the fundamentals. So, I know your first book, you write a
Yeah.
lot about contraceptives.
Yes.
So, how does this impact someone if they are on a contraceptive? Because I know in this current
Mhm.
book, you talk about the difference between progesterone, what we
Mhm.
produce, and progestins, which is
Mhm.
what's in HRT or a hormonal birth control. So, how does hormonal birth control affect what's happening across our cycle, if you want to call it a cycle?
Yeah, so for naturally cycling women, of course, you're going from a state where estrogen is rising and falling, and then you go into the second half of the cycle where progesterone's rising and falling. For women who's using hormonal birth control, you don't get an ebb and flow of hormones because hormonal birth control just like turns off your hormone production by
Mm.
preventing ovulation. And it does this by giving you the same daily dose of a synthetic form of progesterone called a progestin, and then sometimes if you have a combination combined oral contraceptive pill, it'll also have a relatively low level of synthetic estrogen in it as well. And so when you get this same daily dose of progestin, that progestin will stimulate progesterone receptors in the hypothalamus, which has the effect of telling the brain, do not stimulate the ovaries to produce new egg follicles because we think that there might be a pregnancy that's going to take hold. So
Mhm.
essentially, anytime that progesterone is released in the cycle, which happens during, of course, the luteal phase during the second half of the menstrual cycle, that inhibits ovulation because it inhibits the hypothalamus in the brain from telling the ovaries that it needs to stimulate egg follicles and start to prepare for ovulation. And so when you get that same daily dose of progestin, it's sending that same daily signal to the brain that says, don't stimulate the ovaries. Now, what this means is that when you're not ovulating, I mean, ovulation is the primary way by which women's bodies create produce sex hormones.
Mhm.
So it means that women's bodies are not producing sex hormones, right? For the most part, they're very, very low. And the only sex hormones that women's bodies are getting are those synthetic hormones that are in the pill. And again, it's very low levels of estrogen. And then it's got this progestin, which
Mm.
unlike the estradiol isn't biologically identical. It's not even close. The synthetic estrogen in hormonal birth control isn't quite biologically identical, but it's pretty close. It's like a sister.
Okay.
Whereas when you have the synthetic progestins, it's like a completely different compound. And the reason for this is that most of the actions of actual progesterone in the female body happen through the result of action by that neurosteroid allopregnanolone, and the effects of allopregnanolone, affect the body all over the place.
Mm.
And with progestin, you don't get the release of allopregnanolone because progestin isn't synthesized from progesterone. Progestin is synthesized from testosterone usually.
Mm.
Sometimes there's a fourth generation progestins that are in things like Yaz and Yasmin are made out of something called drospirenone, which is a diuretic. But none of them are made from progesterone. And so when they get broken down in the body, you don't get the release of allopregnanolone and you don't get that really beautiful calming effect in the brain.
Mm.
They also cause a bunch of other crazy hinky effects in the body because they're just completely a different compound. Like another really beautiful benefit of progesterone that women's bodies create themselves is that progesterone is catabolic. It likes to break down and differentiate tissue, and it is anti proliferate. It's a tough word for me. It is anti-proliferative, meaning that rather than it like taps the brakes on cell proliferation and instead leads to cell differentiation. And this is something that plays a really important role in developing the endometrial layer and breast tissue for pregnancy, but it's also really important in cancer protection.
Mm.
And because when you have cells that proliferate, that means that they're making copies of themselves quickly, and this obviously is something that's related to greater cancer risk. And progesterone taps the brakes on this, and it leads these cells, instead of dividing, it causes them to differentiate into different types of cells, allowing tissues to mature. And that's both in the breast and in the endometrial lining. Progestin doesn't do this. And in fact, progestin is proliferative, just like
Mm.
estrogen is. And so rather than tapping the brakes on cell growth the way that progesterone does, it does the opposite. And it also encourages cell division, which is why, when you look at hormone therapy that uses progestin instead of progesterone, micronized progesterone or bioidentical progesterone, you see an increased cancer risk. But it's not because of the estrogen and it's not because of progesterone, it's because of
Mm.
progestin. And progestin is proliferative, and you combine that with estrogen, which is also proliferative, and it's just not a positive. It's no wonder that you see a
Mm.
greater cancer risk for progestin based hormone therapy, which isn't even really true hormone therapy because it's shutting down
Mm.
hormone production in a way that I wouldn't call that hormonally therapeutic at all.
Which is again coming back to the sort of zeitgeist of progesterone is bad,
Yeah.
which
Yeah, I
it
know. It's
isn't.
not
Like,
true.
it's like, oh, well, like, it's a how can something that we naturally, normally produce be bad?
Yeah. No,
Like,
I know. And I do think that one of the reasons that it gets a bad rap is just because progestins make women feel so awful.
mm,
And then of course there were those trials of hormone therapy where it's looking at the elevated breast cancer risk, and
mm,
it's all from progestin, it's not from progesterone. And so all of these things I think get lumped together in creating sort of this progesterone boogeyman, when progesterone is actually really, it has a number of really beautiful benefits in the body and also in the brain.
yeah, so really what we want to do as women naturally is support our body in being able to make efficiently and effectively as much progesterone as it can in that luteal phase.
Yes, absolutely. And I mean, honestly, like a good, healthy luteal phase is going to have a lot of progesterone. And
Mm,
and that's what we want. Our bodies are wired for um fluctuating between these two states that are characterized by high levels of estrogen and then high levels of progesterone. And what tends to happen, especially in our environment where, again, we all have too much stress, or we're not getting enough sleep, and we don't have enough social support, and we're not taking care of the physical health of our bodies, is a lot of women will get suboptimal ovulation, right? So they'll either fail to ovulate at all, or they'll ovulate, but the egg didn't really finish maturing because the body wasn't doing enough stimulation of the egg follicle, because it gets disrupted by stress,
Mhm.
both physical stress in the body in terms of inflammation and social stress.
Mm.
And this leads to women producing suboptimal levels of progesterone, and ultimately creates, hormonal imbalances, because you'll have women who are producing estrogen as these egg follicles are maturing, and then either the egg follicles don't finish maturing and they don't ovulate. So they're only producing estrogen that cycle and no progesterone. And that doesn't feel good. I mean, it's not
Mm.
good for the body either. Or
No.
you can get it where women will in fact ovulate, but it's not a very good, it's not like a good ovulation, where you have like a luteal phase dysfunction, where you get less production of progesterone by the corpus luteum. And this again also doesn't feel good to women. Like, it doesn't, like when they're in that state where their body's not producing enough progesterone to counteract the effects of estrogen, it can feel pretty lousy.
Mm. And it's interesting. I'm curious about how this impacts women, say, with endometriosis, because we know that endometriosis is fueled by inflammation and
Hmm.
higher amounts of estrogen.
Right.
And it's interesting that typically the first line, or has been the first line of treatment medically, has been go on the pill,
Yes.
which is a
Yeah. And
synthetic progestin. And
yes.
it also stops that, it stops your own production of estrogen. So it's not necessarily proliferating in that sense, but it's not addressing why it's there. What happens if we actually just supported and cared for that seabed floor and cared for our own natural production of progesterone? Or maybe, like
Yes.
you mentioned in your book, that micronized progesterone.
Mhm. Yeah, no, 100%. Like, and it's crazy to me that nobody is really trying these things with women, and instead they're just giving them hormonal birth control, which, I will say this, like, if you're somebody who has endometriosis, taking hormonal birth control, if it works for you, like, it
Mm.
can be so helpful to those. I mean, they feel a lot better. And it
Mm.
works by keeping estrogen levels low, because
Mm.
estrogen is like super proliferative, specifically in the endometrial area. And when you keep estrogen levels super low, it does have the effect of preventing overproliferation of cells in the endometrium.
Mm.
And generally, what you see, especially with hormonal birth control for women with endometriosis, is that they give them things that have progestin only. So they're just really trying to keep estrogen levels super low, and it can work, but then you're shutting off your hormone production. And is that really good for anyone? Mm-mm. And a lot of
Mm.
these women then, they are told that they're treating their endometriosis. And then they go off the pill when they're ready to have a baby. And then they're realizing that, oh, no, that didn't cure my endometriosis, and now I've got endometriosis I have to deal with, and I can't get pregnant until I deal with it. And so it also creates this, thing where a lot of women feel like they were misled,
Mm.
because then they're getting ready to have a baby and they're not able to have a baby right away because now they're having to deal with the endometriosis. And so, like, why aren't we experimenting with micronized progesterone and some of these other things that might lead to, having these nice anti-proliferative effects in the endometrium? Like, I don't
Mm.
know. I don't know why they're
Mm.
not doing that.
Yeah, and I think I keep coming back to it, and this is what we're talking about, is that whether it's PMS, whether it's endometriosis, it's your body trying to tell you something. It's not a nice thing to feel, but it's also, it can be like, oh, okay, how can I support my body? It's obviously trying to tell me something. How can I support it in a natural way, that the normal rhythms of every human physiology? How about I do that
Yes.
and see what happens with my symptoms? Because if
Right.
I trust my body to give me the symptoms and notice changes, then amazing, incredible. And as you said, like, sometimes medication surgery is one of the best things you can do, but it often doesn't address why it's there in the first place.
Exactly. I mean, there's so much wisdom in what our bodies are telling us, and we have been as women just taught to ignore it and taught to question ourselves and never question the medical advice that we're given.
Mm,
And I'm hopeful that as we continue to have discussions like this one, that women start to change. Sorry, I'm losing my voice. That as we start to have conversations, continue having conversations like this one, that it really starts to change that narrative and gets women to learn to trust their bodies and listen to what their body's wisdom has to say. Because
mm,
oftentimes, as you noted, our body is telling us something.
And I think it's great to have the research that you're doing and hopefully much, much more that's going to be
Yes.
created in that we can understand it from a scientific and a brain-based perspective and go, oh, okay, wow. I had no idea that in the luteal phase I'll feel like this and in the follicular phase I feel like this. But also knowing that our body inherently knows when we can like connect to it and trust it and listen to the wisdom that it has, we can use both. But it's like science doesn't replace our internal wisdom. And
Right.
we can listen to our internal wisdom with some guidance and information from science as well. It's being able to use both, but not one in isolation, I think.
Yeah, no, 100%, 100%. I mean, it's like, yes, our body is telling us things, and the things that, like, we wouldn't be able to decode what our bodies are telling us without the science.
Yeah. Now, I just wanted to touch finally on PMDD, the
Yes.
difference between PMS, PMDD, how what we spoke about today to do with the seabed floor, whether that can help people with PMDD or, yeah, what you would recommend from the science.
Yeah, so PMDD is obviously it's a much more serious form of PMS, and it really kind of deserves a category of its own. But it's changes that women experience in the luteal phase of the cycle, and it can either be the entirety of the luteal phase or just like one, a chunk of it, whether it's the last week or whether it's the last 5 days. Different women have different symptom patterns, but it's generally marked by intense changes in mood that are actually interfering with their ability to function in everyday life, right?
Mm-hmm.
So it's not just that you're feeling bad, it's actually making you incapacitated to some degree. And for many women, it's also characterized by suicidal ideation, right?
Mm,
So a lot of times when women have this, they'll regularly consider whether or not they even want to be around anymore. And it's really a devastating experience for these women. And unfortunately, they aren't given a whole lot of help. Generally, it takes women several years to get diagnosed. So if you're listening to this and you think that you may have a PMDD, I would start charting your symptoms today. And I've got resources in the book that you can use to help get you started, because your doctor is going to want you to be charting your symptoms for at least 2 months to be able to test whether or not it is actually, in fact, PMDD. So get at it to speed up your diagnosis.
mm,
But, it takes women a long time to get diagnosed. And oftentimes, all that they're ever offered for help is birth control pills, because that shuts down ovulation. And so it makes, it shuts down women's hormonal fluctuations, which are believed to be part and parcel behind the symptoms that women get
mm,
when they're experiencing PMDD. It's the idea is that they don't have tolerance for hormonal changes, that their body just cannot respond well to them, particularly in response to changing levels of progesterone, which you get in the
mhm,
second half of the cycle. And so they'll give them birth control pills because that shuts off variation in levels of progesterone. So if you're somebody whose body does not adapt well to rapidly rising and falling levels of progesterone, taking the birth control pill can make you feel better, right? By
mm,
shutting down all that variation and just giving you the same hormonal message every day. Other women are given antidepressants. That's the other thing that women are generally offered when they experience PMDD. But these aren't the only options. And so, one thing to do, I mean, if you've got PMDD and you want to deal with it naturally, I mean, the first thing to do is really stabilize the seafloor.
mm,
And this isn't going to solve all of your problems. Like, I don't think that PMDD is something that, like going on, nature walks and eating a healthy diet is always going to fix. And instead, a lot of times women need something a little bit more intensive, including things like cognitive behavioral therapy has
Mhm.
been found to be really helpful for women. So, one possibility for you if you have PMDD is finding a therapist who focuses on cognitive behavioral therapy. And what's really great about this type of therapy is that it teaches you to reframe negative thought loops so that way you don't get stuck in them and then have it totally destroy your mood. So, like, for example, one of the things that women commonly report when they have PMDD is that they feel like everybody hates them, right? They just feel unlovable and that like everybody hates them.
Mhm.
And if you work with the therapist who does cognitive behavioral therapy, they'll teach you to question your thoughts, right? So they'll teach you to recognize that your thoughts aren't reality, right? They're this product of the brain, usually rooted in fear, and that you can start to recognize when you're getting into that thought loop, and then you start to question it. Like, you're asked probing questions about, like, what is some evidence that this is not true,
Mm.
and starting to think your way through it to be able to actually talk yourself out of some of the spiraling that can really create the negative mood changes, that really can be terrible for women with PMDD.
Mm.
So, doing the regular lifestyle interventions, cognitive behavioral therapy is really helpful. And we're actually doing a study right now that we're going to be recruiting. I think we're going to be starting in January, starting to recruit participants where I'm going to be working with a company called Own Body, and they do vagus nerve stimulation. And we're going to be looking at stimulating the vagus nerve as treatment for PMDD because we have every reason to believe that it should improve symptoms.
Mm.
And when you stimulate the vagus nerve, you can do this by these little devices that you put near your ear, and you put these electrodes here where it's going to be getting into this tissue that will actually stimulate into the vagus nerve, and it increases the communication between the brain and the periphery, right? So the
Mm.
brain and then the rest of the body. And the better our brain and our body are at bidirectional communication with one another, the fewer bad things. I mean, it really, and I say bad things because research has found this to be helpful for almost everything. I mean, it's really amazing, and because a lot of the issues that we have are the result of the fact that our brain body connections are eroded for a bunch of different reasons, ranging to societal changes and even just age. And so what this is doing is trying to improve the communication pathway between the brain and the rest of the body. And there's been really good support for this as being effective for treatment of major depressive disorder for people who have treatment resistant major depressive disorder,
Mhm.
and we have every reason to believe that it's going to improve symptoms in PMDD. And I'm super excited about that because this is something that does not require drugs. It does not require surgery. You don't have to have this. You just stick this thing behind your ear, and the therapeutic dose is generally about 2 hours a day. And it's not like you put this on and then you have to like sit and just like
Yeah.
wait for 2 hours. You can like do it for an hour when you're getting ready in the morning, brushing your teeth and whatever. And this thing's just doing its work. And then you put it away. And then at night, if you're chilling or if you're just like taking the dog for a walk, you just put it on and have it stimulating for another hour. And I mean, in the breakthroughs that this has had in terms of promoting mental health with depression is really exciting. They also find that it's effective for treating endometriosis. And
Mm.
again, like I said, it really affects it's like anything where the body is going totally haywire, oftentimes as a result of a lack of good communication between the brain and the periphery. And so
Mm.
anything that you can do to improve the communication pathway between those two things, if we're calling them two different things, is going to improve symptoms. And so I'm really excited about it because I think that it's actually going to offer something that is relatively easy to do, right? And is obviously non-pharmacological, and so will allow women to still experience themselves and experience their hormones and experience their neurotransmitters and everything else as themselves, but then also get treatment. So I'm really excited about that.
Mm. It's like almost having a focus on cellular health if we think in terms of that seabed floor, but then
Mhm.
also if we're barring the endocrine system, there's also the neurological system that sits on top that's telling the
Right.
endocrine system what to do. So it's like that vagal nerve stimulation is helping to calm or connect the neurological system with the endocrine system in a more harmonious way because they're not separate. They're always going to be
Right.
connected.
It's
It's
yes, they're
just
always
helping the
connected.
connection.
Right, it's helping the connection and allowing the communication to be better and more
Mm.
expedient between the nervous system and the periphery.
Yeah, and we know that they're connected because, for instance, I might be severely hungover or jet lagged or
Mhm.
tired. What are the thoughts that go on in your head?
Yeah.
Not
No, I know,
not great ones.
totally. No, not
If
great.
you've had
No,
sleep,
there's
you're nourished, you've got great
yeah,
connections. What are the thoughts that go
yeah.
in your head?
Yeah, no, I know. It really is incredible. Like,
Mm,
and as some of the other work that I do looks at inflammatory activity and how that affects the way that we feel and experience the world. And the way that we feel in the world is so affected by the physical health of our body and like what's
mm,
happening with our bodies. And in fact, this is just sort of a cute and kind of funny aside. So when I got my COVID vaccine, my very first COVID vaccine, I remember because, people oftentimes didn't feel well. And so I was kind of anticipating it, but I went back to work anyway. And I was like doing my work. And all of a sudden, I'm like, I feel so hopeless. Like everything just feels hopeless. Like, oh no, like my life it does not have meaning. And then all of a sudden the physical symptoms started about an hour later. I'm like, oh my gosh, of course, duh, inflammation.
yeah,
And that just goes to show you what inflammation does. Inflammation changes the patterns of thoughts.
mm,
And it leads you down a more negative path. And it was just so funny to me though, because I was just like minding my, and all of a sudden I'm like, I just feel so hopeless. Like
yeah.
everything is bad. And then yeah, and then I started to like get achy about an hour later and I was like, "Oh, of course I'm feeling hopeless. It's inflammation."
Yeah, which I think is such an incredible thing to say. I had a similar thing happen to me last weekend and I was like, "Why? I'm pre-ovulatory. I should be feeling
Yeah.
amazing. Normally I do." I'm like, "Why?" I had the same hopeless feeling. I'm like,
Yeah.
everything everything in my life is actually incredible. Like everything's
Yeah.
great. Yeah, sure, there's little bits, but like everything's
Yeah.
fine. Why is that? And I'm like, "You know what? Okay, let me go back to my fundamentals. Let me just care for them." And
Mhm.
now I'm like, "Oh my gosh, everything's great, everything's fine," because I'd been at my best friend's hen's party and I'd had alcohol. Normally, I don't really drink alcohol that much anymore. I'm like,
Yeah.
"Oh, okay, yeah, that makes sense." Like, so it's acknowledging the thoughts that can come, but also not believing that thought as truth and seeing that thought as possibly a symptom of something underneath the surface, like inflammation.
Right. Right. No, 100%. And there's so much good research showing that inflammation is related to feelings of loneliness, feelings of
Mm,
depression. And, it's very rare that we experience such as a quick uptick in inflammation like I did when I got my COVID vaccine, where I was actually able to watch it unfold in real time.
yeah.
But a lot of times what happens to people is their mental health just gets eroded by chronic inflammatory activity without them even realizing that it's going on.
Mm,
And instead they just feel like their life is getting worse. And instead of thinking about like, okay, I need to take care of fundamentals because 9/10 of this could be perception. And a lot of times it is. And
mm,
our perception gets so skewed by inflammatory activity in the body.
mm,
And this also, again, contributes to our worst experiences across the cycle. And, when they look at research on women who have PMDD, it does seem like inflammatory activity is a major contributor
mm,
and we know that women who have autoimmune disease and women who have experienced trauma, both of which are related to runaway inflammatory activity in the body, they're at a much greater risk of developing PMDD than the rest of the population, which suggests that it's probably mediated by inflammatory related activity in the body. And so
mm.
anything that you can do to try to like inhibit runaway inflammatory activity in the body is going to be really positive.
Yeah, I think that's such an important point to make, and even seeing it as if you, for instance, had an inflammatory rash on your hand, like, "Oh, okay, why has that come up?" But when we have inflammation in our brain, because we can't see it, other
Yeah,
people can't
right.
see it, we think we're going crazy or why do I feel like this? But if or if we broke our arm or if we have a rash or anything, it seems much more easy to handle, or it's less personal, I suppose. Yeah,
Yeah.
that's
Yeah.
interesting. I wanted to end on my final question. I
Yes,
love to ask all of our beautiful experts, and I know you have a daughter.
I
You
do.
have 2 daughters or a daughter and a son?
I have a daughter and a
A
son.
daughter and a son. That's me Instagram stalking you. So
Like, "Oh,
what's one belief about your daughter's body that you would love for her to have?
I want her to have that, my body is sacred, my body is wise.
Oh, I love that. Sarah, thank you so much for sharing your sacred and wise wisdom with us today.
Thank you so much for having me. It's just a real treat to be here chatting with you.
Thank you. If this episode resonated with you, take a moment to think of the woman in your life who might need this too. Maybe it's a friend who's been feeling exhausted, a sister searching for answers to chronic symptoms, or someone who just needs the reminder that feeling good in her body is her natural baseline. And if you haven't already, subscribing is the best way to spread this message and make sure you keep getting the answers and resources you need. Together, we're redefining how women connect with their bodies. And I'm so grateful to have you as part of this community. So, I invite you to get curious with me. If your body isn't the problem, it's the solution, what do you think your body's trying to tell you today? Please remember, this episode is for educational purposes only. Always consult a qualified health practitioner before making any medical decisions. Every body is different, and so is every healing journey.